Welcome to this video on Osteoarthritis Initiative imaging. Before we get started, it's important to remember that the OAI is a cohort of almost 4,800 well-characterized participants that have data and resources available through 3 publicly accessible repositories, which create rich and linkable data sets. The first repository is the NIMH Data Archive, or the NDA OAI website. This is where you can go to download clinical data, the actual images, as well as image readings. The Genome-Wide Association study is available through dbGaP, and the biospecimens can be requested from the biospecimen repository. For the purpose of this video, we'll be talking primarily about the resources available through the NDA OAI website. All participants had a comprehensive imaging performed at baseline and the annual follow-up visits through 48-month follow-up. They also had additional imaging completed at 72 and 96-month follow-ups. The most common radiographs were the bilateral posterior-anterior fixed flexion knee radiographs, and participants also underwent a 3 Tesla MRI, which included sequences like the sagittal 3D DES, which is commonly used for measuring articular cartilage. And there's also a 3D flash sequence available, as well as several 2-dimensional sequences, such as the sagittal intermediate weighted fat suppressed sequence. The most common X-ray in the OAI is the posterior-anterior fixed flexion knee radiograph, which was used for doing semi-quantitative scoring, such as the Kellgren-Lawrence grades, as well as for quantifying joint space width at fixed locations. There are other radiographs available, including fluoroscopically positioned knee view within a subset of the progression subcohort. These were collected at baseline, 12, and 24 months. Members of the control subcohort also had lateral knee views completed at enrollment and 36 months. And participants also underwent a full limb radiograph for measuring hip, knee, ankle angle at 12, 24, or 36-month visits. Participants also had pelvis x-rays and dominant hand x-rays, with some individuals also having bilateral hand x-rays available. Other MRIs include MRIs of the thigh for muscle assessment at baseline, 24, 48, and 96-month visits, and a subgroup also underwent additional imaging at 18 or 30-month OAI visits. 2 groups of the OAI also received bilateral knee DEXA scans and unilateral hip DEXA. The progression subcohort members had their DEXAs performed at 30 or 36-month visit and the 48-month visit as a follow-up. Members of the incidence and control subcohorts had their DEXA scans completed at the 72 and 96-month visits. In addition to the raw images, there is an array of publicly available readings. These include semi-quantitative radiographic assessments of knee and hips, radiographic assessment of limb alignment, including femoral tibial angle and hip knee ankle angle. Radiographs were also assessed for quantitative joint space width at fixed locations. The MRIs have been read for some individuals using semi-quantitative knee scores, such as MOCs, and quantitatively assessed for articular cartilage metrics. Some of the individuals who had DEXA scans also had quantitative trabecular morphometry completed. There's some important tips to consider when using the publicly available readings. In each file that has data for longitudinal or cross-sectional image readings, you'll find a read project number. These are important because longitudinal data within a read project can typically be merged, but not all read projects should be merged together. You need to carefully consider the study design and imaging methods before merging and analyzing the data. It's also important to read the OAI documentation, especially since some of the documentation will provide suggestions on how to merge data across projects or within projects. If you have questions about how to handle data from multiple READ projects, please contact the PI or the OAI core knowledge base for assistance. To access the OAI images, you can go to the NDA website to download images and data. The data can include things like image metadata, for example, who has which images and when. You can also download image-derived biomarkers, such as the quantitative joint space width measurements or quantitative articular cartilage thickness. You can also go to the NDA website to download the raw images or the related documentation and tools for exploring the data. The OAI Core Knowledge Base can help you when you need assistance on creating imaging sets, and we can also help create and deliver imaging sets via cloud or hard drives. If you have questions or need assistance, please contact the OAI Core Knowledge Base. Our website is oaiknowledgebase.com, and you can email us at oaiknowledgebase@umassmed.edu. Thank you for your time.